Hi, my name's Evie and I have been part of Medscribe for the last 3.5 years. This video is just going to basically give a very quick overview as to what the course entails. So basically it's an incredibly comprehensive course that is very focused on doing practice-based learning. So doing lots and lots of practice cases to make sure that you feel like you've had a good enough experience before jumping into the clinical setting and giving it a go with real patients. So a lot of it is practicing with a combination of mock and real patients. From there, there's also a lot of terminology, learning about some of the pathology that you're going to see, learning about different abbreviations and how they're used in the clinical setting, particularly in ED, it's very abbreviation based, and from my experience so far, but learning about and just getting your mind in this setting before jumping into a real life patient case basically. So it's incredibly intensive, and I would personally recommend getting the course knocked over as quickly as possible, purely because the content that you learn one day is going to be more easily built upon if it's fresh in your mind. So the way that I did it personally was by getting it over and done with as quickly as possible and treating it as an intensive, because that's going to help with your transition over to the clinical setting as well. Just once again want to emphasize that there are lots and lots of practice cases with a combination of real patients and practice patients. It's really good for that feedback that you will be able to, one, get from us, but also to criticize yourself as you watch over things again. And so hopefully that will be very useful to you as it was for me. Another thing that I just wanted to mention as well is that the idea is we get you as much experience in this setting before transitioning into whichever medical field you're going to be working within or department, because that will hopefully reassure you that all you'll have to get used to doing is learning where pathology results come through, learning the logistics of the department, and hopefully you'll be quite confident in your understanding. However, it is an incredibly steep learning curve. We're not expecting you to know everything at the beginning. However, we want to give you as much information as possible to help with that exponential growth of your knowledge and terminology. Within the course, there's also quite an emphasis on spelling and typing, purely because that is a very large component of the role as a medical scribe. So learning about the spelling of particular words, learning about how those words come about and what they relate to, and quite often learning how the prefixes, suffixes, the word roots are going to help give you hints as to what's actually going on in the body. And learning those things early on in your training is going to help you again with that exponential learning curve, but also throughout your time as a medical scribe or within the healthcare system. The sooner you get on board and get to learn those terms, the sooner you get to be of benefit and get to contribute to that team, which is incredibly rewarding. I hope that gives you a very brief overview as to what this course will entail, and please let us know if you have any questions at all regarding the course or regarding any of the content, because at the end of the day, if you've got those questions, it's most likely that somebody else will also. Thank you, and I will see you guys soon.